Following new guidance regarding COVID tests, Valley News Team's Nishay Taylor explains why some local healthcare providers say they won't be testing you.
At-home COVID-19 tests are becoming more available, some health experts say.
If you have a positive at-home test, there is no need to repeat that with a medical facility.
Many health facilities, including Sanford, will no longer offer a test if you have tested positive for COVID at home. Sanford health officials say they are already administering record numbers of tests.
We're doing at Sanford about 7,000 tests going to our reference laboratory a day, and that's not even including the antigen tests that we're doing rapidly in the clinic.
Doug Griffin, the medical officer at Sanford, says they have plenty of tests, but they do not have the staffing to handle the high demand. But how accurate are at-home tests? Griffin says vary if you're actually COVID positive.
98-99% accurate for people with symptoms. And that could even be mild symptoms. So
if you do not have symptoms, that percentage drops. And there are other complications like a user error.
False positives are very rare. It's more likely to have false negatives.
If you do test negative but have symptoms, you could be sick with something else. Health experts still recommend visiting your primary care doctor for an evaluation. In Fargo, Nishay Taylor, Valley News Live.
Sanford health officials say they are planning to start asking if a person has had a positive at-home rapid test before offering you a PCR test. And a quick note, some studies have found that at-home rapid tests aren't quite as accurate as Griffin suggested. One found that antigen tests correctly identified COVID in an average of 72% of people with symptoms and 58% of people